RW Health Tech is technology designed for healthcare system integrations and cost savings. Just a bit of background about our platform. As the founder, I've been engaged in public health for the past 10 years. I'm originally from the Bay Area. Ever since I was a young person, teenager, I was working in San Francisco with Department of Public Health, working on special projects, doing public health advocacy, and I went to SF State as well. And by engaging in that, I was actually able to really get firsthand experience in terms of what's really wrong with the healthcare system in regards to the technical changes that need to happen, right? To like Medicare and billing and the adaptive changes that need to happen in terms of what services are offered, how are communities hired in the healthcare field, who's doing staffing, et cetera. Our organization, we did begin in the nonprofit space, as I mentioned earlier, coming out of public health advocacy. And we noticed that there was not a lot of support for the work that we were doing in terms of changing the public healthcare system because a lot of the existing clinic networks and public and private systems, they actually benefit on the ways in which the current system is running, which is trying to focus on addressing just the symptoms of healthcare versus really focusing on the somatic and socioeconomic factors that create disease in an individual. I've done a lot of leadership in the fintech space via blockchain and alternative digital currencies. Helped to start the Blockchain for Social Justice Collaborative. Won a lot of different awards in the tech space for doing equity work and whatnot for our leadership in the fintech space, which is what brought us here and promoted a lot of the development of this platform. And I did go to school for public health. I am currently finishing up my master's degree as well in public health, but I am also trained in alternative and holistic medicine, having experienced, having had my own issues with chronic health as well. And utilizing these alternative practices to support me, and how that actually saved me from having to get a bunch of prescriptions and going back and forth to the doctors, and how that saved, my providers as well and those who provide coverage to me. So let's meet Martha. Martha has type 2 diabetes. Her type 2 diabetes is actually induced by somatic and socioeconomic factors driven a lot by economic disenfranchisement, generational trauma, etc. The problem here is that Martha's diabetes costs $13,000 annually for not only her, but taxpayers and the public healthcare system. The issue with that is all the funds that we're putting into trying to address chronic illness is money that is being lost from really addressing the hardcore issues that are causing public health problems, as well as research and innovation. The second problem here is Martha is not really getting an accurate treatment of her symptoms. She's really getting services that suppress her symptoms versus really treating them and having effective maintenance. Some of you guys have seen documentaries such as Forks Over Knives, where doctors are literally treating people of diabetes and bone disease and cancer just using a diet, right? So imagine if we were able to provide have covered services, nutrition, acupuncture, herbalism, et cetera, for chronic illness patients, which have been proven by science, empirical, scientific, and psychological research and evidence to work. And the third problem is lack of coverage for out-of-network services. Currently, there's the CMS system, which is basically the Center for Medicaid and Services that funds Medi-Cal and Medicare across all 50 states. They don't cover these alternative services, but they do pay out of pocket, and they do cover reimbursement when you partner with another physician. But that is very problematic, and it takes a long time, and it's very slow, and it creates gaps in services. So these are the problems that we're trying to address with our platform. So what is our solution? Our solution is a fintech platform that provides an alternative payment solution for both public and private systems that want to support their high cost chronic illness patients with reducing their disease metrics and reducing cost and service overall. Our platform provides an integrated model, so it streamlines the integration of fragmented systems, the healthcare system, the social service system, the individual's personal life, their caretakers, across the service to treatment timeline. So across the timeline, the different actors and providers are able to communicate from whatever platform that they're using, because our platform can be used as an API. So providers don't have to go sign up for something else again, which is also a problem, like a platform burnout. They can just go ahead and sign into their Epic account or whatever public health or private EHR system or EMR that they use within their network. So our target market is public and private healthcare systems, and our second target market is individuals who don't have coverage, as well as providers. The way that we generate income is we retain a percentage of all transaction fees. So some of our current milestones is we've completed the development of our platform debt-free. By doing contract work, we were able to pay it off. We've generated over 70K in revenue with our MVP. We have a database of over 800 providers and beta partners secured. So we're asking really for $30,000 to complete the front end development of the beta platform, and then also launch and improve our beta version and expand our existing revenue streams to larger B2B customers. So that is RW Health Tech. Thank you so much.
And thank you for that, Daisy. Thank you for clarifying that you were going to be an API, because I do know that there's lots of EMRs and lots of options for healthcare providers to choose. Mm-hmm. So knowing that, where do you plan to structure your entry into the market? Are you planning on going to the larger providers first, working with smaller medical offices, going to the hospitals? What's your market entry plan?
Well, our market entry plan is first to work to kind of focus on individuals that don't have healthcare plans, or they want to seek alternative coverage for themselves. Then the second pathway of entry is working with the larger public healthcare systems, because within one state, they're all funded by the Department of Healthcare Services or the Public Health Department. So we want to partner with those larger services, those larger departments, in order to utilize the platform and onboard all of the other public health departments within specific counties. And the way that we would generate income is there's specific funding that folks don't know about. Like there's billions and billions of unspent dollars in CHIP, childhood insurance program money, CMS money, et cetera, across every single state that can actually be used to cover these services. And we did a lot of that work in California via the Children's Trust. So you should look into that, into like, some of the research that they've done in terms of how we can use this money when it comes to like the private systems, like the private hospitals and insurance companies and like school systems and workplaces. That's our point of entry, is to partner with the HR departments. Like, hey, like this is something that you should pay into for your clients and whatnot. For school districts, like, hey, you guys have like young people who they're experiencing a lot of behavior issues because of trauma. Why not try out these services that can actually, help these young people reroute their nervous system? So that would be our point of entry, doing like the small beta partnerships and versions, proving the track record, and then onboarding larger systems once we can show, of course, that we can save our customers money.
Daisy, great presentation. I feel your passion coming through the screen. I'm talking about the subject. I guess a comment that I had for you, and then just kudos to you in terms of having the platform done debt-free. I think your raise is very reasonable, and it sets you up for success in terms of maintaining control in your future. Sometimes you can raise too much money up front. If it's not allocated properly, you lose a lot of percentage of your company. So I think what you're doing and what your point put out, I think is very attractive for the investor.
Thank you. I appreciate that. And that was the whole entire goal.
Daisy, the telehealth is exploding right now. And I was just curious, as you were going through the presentation, does it play a role in what you're doing? Or does it impact what you're doing? I'm just curious to see your thoughts on that.
Telehealth is interesting. No, because for alternative services, you would have to go see the individual in person. For specific type of services like herbalism and nutrition consultations, the provider and the patient can agree, okay, do we want to do this online or do we want to do this in person? So telehealth is something that doesn't really impact our platform, because that's really more for providers like physicians and physicians assistants and nurses, et cetera.
Okay.
Mm-hmm.
Vote for your favorite pitch by visiting www.sheraise.com. Select a city, enter the donation for the pitches you love, and don't forget to leave feedback and/or hype comments for our founders.